Jefferson Regional Medical Center is both a community hospital and a regional referral center. We're licensed for 471 beds, and we serve a population of about 280,000 residents, but they're spread across an 11-county area. Pretty poor socioeconomic conditions. Unfortunately, that often leads to poor health and a lot of chronic disease and illness, so it's a challenge clinically for us to manage those patients.
As you can see, the thresholds improve, so as well as our performance and quality.
Data is so important to our board at Jefferson Regional Medical Center because it forms the basis of our decisions. It lets us know in what directions we must head. It lets us know how we are comparing ourselves and others with the quality standards and measures that we've set.
And as you can see, for heart rate, we're above the state and national average.
We've leveraged our data from the Hospital Engagement Network to do a deep analysis of our compliance across the 10 HEN initiatives, allowing us an honest assessment of our progress every step of the way.
Continuing to monitor our progress.
I think some of the things that HEN brought us was some of the data and the best practices that we could then hardwire, so to speak, into our electronic medical record system. And then that allowed us to build a package of not only documentation, but workflow, rules, alerts, etc., that incorporated some of the elements of the HEN.
And flag them so that they know.
And that'd be under patient info here?
Well, under patient list.
We continually educated our staff how to effectively use the new processes and workflows so that our technological investments paid off at the bedside. The clinical informatics department works directly with the nurses on how to assist with the clinical workflow and data coordination.
There is an order that's missed that was crucial or critical. We need to report that.
One of the areas that clinical informatics helped educate our staff was with our VTE. They actually built an assessment for the nurses to complete, and based on the nurse's assessment, it populates an assessment for the physician to go in and score, and based on the two assessments, the system actually allows the physician to score the patient and order the VTE most appropriate for that patient.
Have you fallen in the last 6 months?
I'm not sure it was an intended consequence of the HEN to help institutions improve their financial capabilities, but through the measurements of the quality and safety and the utilization of the data, we've seen improvements in safety and quality measures that I think for the future translates well into value-based purchasing.
I think our biggest accomplishment and achievement with the HEN network is that our governing body, our CEO, our senior management and leadership really bought into the HEN project and the patient safety initiatives and the positive experience it would allow our patients.
Clearly our data and our scores point to success. Since participating in the HEN, we've been very proud of our results. We've had over a 40% improvement in 8 out of the 10 core measures of the HEN, and a little more specifically, performing better than the state and national averages on 117 out of the 127 measures that we track as an institution.
Thanks for tuning in to HEN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.